Today I want to talk to you about one of the more common conditions that I see in my office. That's a bunion. What is a bunion? A bunion, otherwise known as a hallux valgus deformity, is a condition that generally can be genetic, inherited, and gradually progresses with time. This involves your first metatarsal and your second metatarsal. We look at the angle between these two bones. Over time, this first metatarsal can begin shifting away from the second metatarsal and away from the rest of the foot. In turn, the great toe or your hallux can turn in towards your second toe. This is the condition that we call hallux valgus deformity. Some people have a mild hallux valgus deformity and other people can have a more severe deformity. We assess that on x-rays, clinically, and how painful the bunion may be for the patient. The first treatment option, of course, would be something conservative. Most of the time, it's modifying our shoe wear. So the first thing that we opt to do is get a wider toe box shoe that will not be pressing against the medial first metatarsal head, which is where the bone is starting to shift and become a problem with shoe wear. There are some different types of pads, some toe splints and other toe separator devices that can be helpful in comfort. But I do like to mention that none of these different devices will correct the deformity. These devices are only there to simply help provide you comfort or relief of pain. The only way to correct a bunion definitively is to do something surgically. Sometimes we'll consider a cortisone injection that can give you some relief of the inflammation, but the permanent correction to this deformity would be something surgically, which would involve correcting the malalignment of this first metatarsal. This can be done either through osteotomies, which is a cut through the bone in order to shift it. The other option sometimes involves soft tissue releases as well as fusions. So this is an x-ray of a classic bunion deformity. Here you see on the right, the first metatarsal again is shifting away from the second metatarsal, creating this enlarged angle between these two bones. You can see that the hallux, the great toe, is now actually leaning in, drifting in towards your second toe and rubbing against that second toe as well. So this is a classic demonstration of an x-ray of someone with a bunion deformity. Now, if you want to look over here on the left, you can see that this is now the corrected deformity. So here now her first metatarsal is straight. The toe is also straight. So this has been corrected. This particular patient was corrected with what we call a fusion. And all of the corrections of the bunion deformities do involve some soft tissue release as well. The tendon that inserts on the base of this toe is released, and the capsule over on the inside of the medial aspect of the toe is tightened. So there's a combination of soft tissue correction, releasing and tightening, as well as bony alignment. In this case, she was corrected with a fusion. Other patients with different deformities or different angles sometimes are corrected with other procedures such as osteotomies or soft tissue and bone procedures, as we previously discussed. Each person has a different treatment based on their radiographic and clinical findings. That's why it's very important to have your bunion assessed if it is becoming painful. No two bunions are the same. We treat them each individually and uniquely depending on your clinical and radiographic findings. If you're having pain in your bunion, please don't hesitate. Come and see me today.